Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by nurse manager of RUMC's Ambulatory Infusion Center, Lori Gargiso. Welcome. Thank you for joining me today.
Thank you.
Through RUMC Connections, you'll meet the fantastic doctors, nurses, and medical professionals that make our hospital thrive. We'll also provide useful information about your own health, explore the latest medical news, and hopefully get you answers to some of your own health-related questions. So, Richmond University Medical Center's Ambulatory Infusion Center provides comprehensive services, which we'll get into today, in a very comfortable and stress-free setting conveniently located on Staten Island, so you can be close to home. It is staffed by experienced medical professionals and nurses who are dedicated to providing the highest quality care through a clinical approach focused on each individual patient's health. So today we'll discuss all that the center offers and the wide array of infusion treatments available for acute and chronic conditions. So welcome once again. Can you explain to us a little bit about what your role is in the infusion center and how long you've been with RUMC?
I've been with RUMC about 4.5 years. I've been doing this role as nurse manager for about 2.5 years. I'm also the nurse manager of SLP5, which is in correlation with the Ambulatory Infusion Center because we see patients inpatient and then they go outpatient for treatment. So that's what I've been doing there, and that's about 2.5 years.
Okay.
That I've been there.
So I would imagine that you kind of have to love your job because people probably come in, pretty nervous, especially if they're new to getting infusions. So how do you educate patients about their infusion treatments to ease, their anxiety and help them understand the process?
We do not want anyone to be nervous. Mm-hmm. It's a very welcoming atmosphere. So when they come in, we greet them, we make them comfortable, we explain what's going to happen that day, how long their infusion will be. We make them as comfortable as we can. We offer them lunch, snacks, coffee, tea.
Nice. Yeah.
We have the television's on. There's music. We try to just make them comfortable before we start their procedure.
Yeah.
So we explain everything that's going to happen to them that day. And it's a nice, welcoming, I want to say it's almost like going to your friend's house when you come in, because we usually get to know the patients on a personal level, first name basis, and their family, because we really encourage the family to come and stay with them during an infusion.
That's great. No,
Yeah.
Definitely a nice way to keep company and make the time pass faster, I'm sure. Okay.
Yeah.
Explain what infusion therapy is used for. What do you see most commonly?
So we have an array of infusions. I know most people think of an infusion center right away. They think of chemotherapy, which we do.
Yeah.
We do chemotherapy, but we also have infusions for blood transfusions. We do IVIG. We do hydration. We do iron infusions. All different types of infusions come into our room.
Yeah, and that's something people might not know about. Like pregnant women, they might be low in iron, and they can come, right, for iron infusions.
Yes. We have pregnant women that come, which is a nice experience for us too, because as they come each week, we see, how they're progressing, and they're very happy that they feel they have a lot more energy after their iron infusion. So that's a nice little addition that we do. And it's not all for chronically, ill people. Like with the iron, like we just mentioned, but also sometimes people with their diets, they need certain types, iron again, nutrients, things like that. It's an array of different infusions that we do.
And I'm sure because you do such an array of different infusions, you have a chance to interact with a lot of different doctors from different departments, right?
Yes, our nurses interact, and I interact with oncologists, rheumatologists, endocrinologists, gynecologists, OBGYN, regular medical, doctors.
Yeah.
We interact with everybody.
That's great. So you get to know a lot of
We get to know a lot of information, and we're learning every day in that infusion center.
Wonderful. Okay, so I think, there are some misconceptions, like you said, that infusions are for chronic or critically ill patients. So I'm pretty positive that we can debunk that with what you just said.
Yes, we definitely can. I also have, and especially we create an atmosphere that no one is coming in there being nervous.
Yeah.
We don't want any of that. They come in, we explain everything like I said in the beginning, and it's a very relaxed area.
Yeah.
And people actually thank us a lot when they come in. We're a small infusion center.
Yeah.
And you know, we thrive on that. We thrive on getting recommendations from other patients that we have had in the infusion center. So it's a welcoming
I'm sure because
situation.
it's a smaller,
Yes.
center, that it gives it a bit more of an intimate feel where, like you said, you do get a chance to know these patients on a, a first-name basis and build a relationship.
We do, and it's very nice.
That's great. And so are there certain things patients should or shouldn't do before or after an infusion if they need to prepare?
Well, usually it depends on what type of infusion they're getting. So we obviously like them to be hydrated if they're coming in for chemo.
Yeah.
Afterwards, certain type of chemos, you really can't drink very cold liquids or ice cream or
Too
things
sensitive?
like that. Yes, you can have a bit of a reaction. So we try to, we prep them all beforehand. We have Jackie, who's our secretary, and she calls everybody and she talks to them. And then we have our nurses that call and remind them what they should and shouldn't do. And then also, which is a nice addition, we have a unit assistant that is in our room. And she's there basically to be your person that's going to get you anything you need while you're there.
Oh.
So it's very nice.
It's like a little concierge service.
Concierge service, yes, that's what I was going to say.
Okay.
And it's really nice. I'm back there a lot, all the time, basically, and I see everyone, very happy and we have a lot of good outcomes, positive outcomes that I've seen in the past 2.5 years that I've been involved.
Do you have a most memorable patient or story?
Well, actually, just like 2 days ago, we had a patient that rang our bell because it was their last chemo treatment.
Oh, that's great. That must feel like a very rewarding experience.
Yeah, it
to
was
be
great.
A part of.
She was really happy. The family was happy. We took a picture. It's a very positive experience, and it's nice. It's an accomplishment.
It is.
And then also we'll follow up with them and see this week I'll give a call and see how they are, how they're doing. They appreciate that, and there's always other questions, so it's good because I'm out of the blue call.
Yeah,
so it's nice.
That's very nice, and it's nice that you keep in touch, of course. Yeah. So what would you say that the most common infusions are that you do on a day-to-day basis?
Day-to-day basis, we do, like I said, the chemo treatments, like Rituxan is a popular, one that we do for the non-Hodgkin's lymphoma. And then we do Humira, which that's popular. A lot of people will know that. There's a lot of commercials on that on TV.
Okay.
So we do the Humira for the Crohn's disease. Anything that you can basically imagine. There's tons of chemotherapies that we're working with. And we are getting involved with working with doctors that work with us in our hospital. And also we do, like I said, the iron infusions, which is good, and blood transfusions. Yeah. We incorporate, this is a little nice addition that also is happening now, which is new. We have patients from the nursing home.
Oh.
So they don't have to be hospitalized. They're coming over to our ambulatory infusion center. Most of the time it's blood transfusions and hydration.
Okay.
So that's nice. So they don't have to go through an ER
and
then be hospitalized for something like that.
Why make yourself more susceptible to other things? Yeah.
So we're doing that addition, which has been up and coming, and we've had a few patients from a few of the nursing homes around Staten Island.
Okay.
So I think that's nice for them because they're already in a nursing home. We don't need to make them go to be hospitalized for something we could do in maybe 6 hours, something like that.
So let's say outside of, the chemotherapy and the blood transfusions, some of these other doctors, like say an endocrinologist or a rheumatologist, why infusion therapy versus a normal prescription that maybe they would take orally? What are the benefits of the infusion versus just, an oral medication?
Well, the oral medications take longer to work. An infusion is less time, so they'll reap the benefits of having the infusion.
Okay.
It's also controlled, where we use our pumps that we put the time in, how long we want the infusion to run to. It's monitored, it's controlled, and you're right there during the whole infusion, so we're watching you.
Yeah.
And we know what's going on, but it's definitely the time. It definitely works. It definitely works better. For the people if they do the infusions.
That makes sense. How frequently do these people come in for infusions?
So again, with the chemo patients, we can have them come anywhere from 1 to 2 times a week. Sometimes we have infusions for hydration. I have someone that comes most recently, like 5 days a week.
Wow.
Right, for hydration. And basically, like, going back to the point where they don't have to be chronically ill. You know, in some cases, they've had surgery and they just can't drink a lot.
Okay.
So they're getting the hydration.
Okay, so yeah, so
And
that helps.
and it actually, speaking to the patient, was a lot of anxiety for her to try to drink.
Wow.
Like, you know, let's say 64 ounces of water a day.
If you don't feel well.
Right. So now she gets to come to the infusion center and she gets a bag of IV fluids.
Perfect.
And she's relaxed. We give them heated blankets. I forgot about that.
That's a nice touch.
So she's very, very comfortable,
Yeah.
very sweet. Yeah, so.
That's nice then, to,
Yeah.
you know, to be able to take that burden out of, you know, certain conditions and offer something like that.
Right. So there's always things are changing in there.
Yeah.
There's always new ideas of how we can make the care of the patient a little bit less stressful and convenient.
Yeah.
And I think, you know, it's a great way to be. So they don't have to sit there and take pills on top of pills on top of pills,
course.
which can cause other problems.
Yeah.
Gastrointestinal problems, you know. So this way, you know, you have to watch for side effects. But when you're in the infusion center, we watch diligently.
Yeah.
Right. So we're very proactive. The nurse is critical think all the time. What could happen?
Yeah.
We always want to know what could happen so we can prevent it. So that's one of the other parts that I really like about our particular infusion center.
Are there any particular side effects that you see, you know, most frequently, common?
I do. With the chemotherapy, not all the time, but you could get a little bit of a temperature.
Okay.
So then we give Tylenol. We give a lot of pre-medications, which is good.
Which helps.
So we give a pre-medication. We can give Tylenol. We give Benadryl.
Okay.
We can give prednisone in order to counter-effect the effects that can happen while you're getting the infusion.
But I've heard even the chemo they've improved where patients experience a lot less nausea than they
Yes,
used to.
we do. We give Zofran as
Yeah.
well. Yeah, I mean, it really has come a long way.
That's great.
Where it's you know, it's not something anybody wants to do.
No.
But if we can make it a little bit more comfortable and educate the patient, because I find being a nurse, you know, for as long as I've been a nurse, if you educate the patient and you let them know what could happen and what we're doing to prevent those things, the anxiety level decreases.
Yeah.
So
That makes sense. No,
Yeah.
that's a nice touch. And what's the duration usually of most of these infusions?
we can have anywhere from an hour and a half to like a 7-hour treatment,
Really?
a 6-hour treatment.
Wow. Are those the chemo ones that are usually the longer ones?
The chemo.
Yeah.
IVIG treatments, they're usually 3 hours. Iron infusion treatments are about 30 minutes.
Okay.
Hydration, depending on what we're giving the hydration for, could be anywhere from 2 hours to 3 hours, or it could be an hour, depending on how slow we're going to run the
Drip
the
and
infusion for.
everything, Yeah.
Yeah, so we have. That's why it's actually incredible the job that the nurses do, and actually I try to do. And we have our secretary that works very well with putting the appointments in and making sure that everybody is there getting their individual time with the nurse, which is nice.
Awesome. Oh,
Yeah.
That's great. And over time, does the frequency or, you know, the duration of these infusions change the longer somebody's being treated for something?
They could change. It just depends on each case is different.
Yeah.
So I you know, sometimes they want to skip a week of chemo and just come for hydration, or we also do the platelets. You know, we do the blood transfusion, platelets,
Yeah.
things like that. So it just depends what's going on with the patient.
Mm-hmm.
But just because they're getting chemo doesn't mean they're not going to come and get hydration that week. So we follow them. You know, we follow them with the doctors. And we do a complete care, whatever we need to do.
Do you work closely with organizations like New York Blood Center or anything like that for the blood transfusion?
What we do is we actually get patients from there,
Okay.
but we have our own blood bank.
Okay.
So, which is nice.
Yeah.
So
of
when you
course.
come in, you'll have to, you get all the blood in-house. So it's just when you come in, you take blood work, and then, you know, then the next day you'll come and your blood should be ready, which it will be, and then you get your in transfusion. So we don't necessarily work with that company.
Okay. Yeah. No, that's good that everything is in-house. That's
Everything's in-house, which is why it's the best place to be. I find that when the infusion centers are in a hospital setting, it's a safe for the it's very safe for the patient.
Yeah.
Go off if something happens. We have the resources to take care of it quickly.
Yeah.
And we do. Right. I have to say, I can say with confidence, any patient that comes into the infusion center is taken care of like they were my own family.
Yeah.
And I stress that with my staff.
That's a really nice touch.
Yeah.
You know, that's the most you can ask for when you visit,
Yes.
something like that is that,
I'm advocating constantly for the patients. If I feel something is just a little bit off, we are questioning it, and if we have to stop something, we will stop it, and you're taken care of 100% with diligence.
So can you explain what biologics are and what they're used for?
So biologics.
Yeah.
So biologics are the things that we were talking of, like a Humira, which would be for the Crohn's. So,
Okay.
People see commercials for that.
Yeah.
It's basically made from like living organisms.
Oh.
Right? So antibodies from humans, they can be microorganisms from animals.
Yeah.
So basically that's a little bit different. So Humira we do give in the infusion center. Also vaccines, if that's something everyone knows about, right?
Yeah.
So those are biologics because
Okay.
they're live vaccines, right?
Yeah. Do the infusions ever, go in combination like with pills, in some cases?
Right. We do have people on injections, and we do have them with infusions.
Okay.
And by mouth, depending on what the doctor wants the regimen to be.
Okay.
Right.
So you can have a combination.
So basically, when they come in, we're not going to give the by mouth medications. We're just going to give the injectables, and we're going to give the infusions.
Okay. Are there any major risks associated with infusions, or is it more, the minor side effects that, you mentioned before that people could experience?
Right. The minor side effects is which would basically be what we're infusing into you. But just like getting an IV, you have to make sure that it's prepared the right way because remember, when you're coming in, you are getting an IV inserted.
Yeah.
So we have to make sure there's no bubbles there. Everything is secured because we don't want to make issues.
Yeah.
So basically, it's mostly the side effects of the medications. That's the thing that people don't like when they have to get the IV. But we make it so the nurses are excellent at doing IVs, so they don't even feel anything, which is good.
Yes.
My nurses have been there working together for a while, so everyone helps each other out, and they're just really a nice group of nurses that work in there.
Nice. And everybody always appreciates a gentle touch.
Yes.
Okay. Very cool. Are the medications provided in the center typically covered by insurance?
So most of the time, I'm not going to say all of them because I never want to say that. But what we do is before the patient does come in, we do get authorizations and we deal with their doctor that's referring them to the infusion center. So we do get the auths. And then maybe there's a copayment. Most of the time I'm seeing they are covered.
But that's great. I mean, especially for something like an IG infusion, those could be hundreds of thousands of dollars if you look at, the cost for them. So to have the option to, have.
So we try to get all the payment and everything out of the way. So when the patient's coming, they're only concentrating on getting better.
Now, what are you seeing technology-wise? How is technology enhancing the patient experience or improving treatment outcomes in infusion therapy?
From years ago, we have obviously these pumps that actually we could put them in we could regulate them to how much we want the infusion to run for, how much of the infusion they're getting. So that's standardized, so that's good.
Because it used to be a lot slower without these pumps, right?
A lot slower. Also, the safety of, just with giving chemo, even for the nursing staff and for the patient, the way the chemo is made, the bag is God forbid it breaks or anything like that. It's not going to leak anywhere. I mean, sometimes, but I haven't seen that. But basically, the pumps and it's just in a more of a controlled area. Because years ago, the infusion centers, they weren't, I don't believe, as popular. So you would have to go into a hospital setting and not outpatient to get it. So I just think just in that sense, it's better for the patient's experience, not to be hospitalized.
Okay.
And that's what we try not to avoid.
That's interesting.
Yeah.
And I feel like lately, I had Dr. Shanazarian, one of our gastros, on, and like with all the stuff that's, coming out now about, the gut and being the second brain and things like that. Are you seeing more gastro-related infusions or wondering if on the horizon there'll be more for that?
I mean, like I said, we have patients with Crohn's that come in a lot. Old 18 and above we get.
Yeah.
So we have had patients like that. I'm hoping, that we do get more patients because then they'll feel a lot better because
Yeah.
they can get their infusions.
No, it's interesting to see as technology and everything evolves what will be, next on
Right.
the horizon for everything. So.
Well, even with the AI, like that's
Yeah.
big, right? Not that we're utilizing that right now, but I think in the future that's
Yeah.
going to be a big help
Can be very
with,
useful.
even diagnosing patients, what type of regimen to use.
Yeah.
It's just very interesting how I think that's an up and coming
Yeah.
area of expertise that they'll use with, especially in
The medications, I've seen
Yes.
a lot about that. Yeah. With using it quickly for interactions or things with other medications. So, yeah, it's been a very
Yes.
useful tool. So that
Yeah.
could be something.
Also the availability to even the nursing staff, where years ago maybe they didn't have Google, they didn't have certain types of websites you can go on and find out quick information.
Yeah.
So that would have to be probably delayed because they'd have to find a doctor, and who knows when the doctor would come.
And research it. And I know
Right.
it'd be a lot
So
slower.
technology definitely assists us today, which is great.
Okay, very cool. And so, we see a lot of commercials for various medications that treat, different conditions. If someone has never tried a biologic and they think, well, maybe that might be right for me, where do they start? How do they go about, getting into our infusion center?
Oh, so usually what happens is if they see like a commercial like everyone sees on TV, right? So I would definitely start by reaching out to your doctor, either your primary care doctor. Obviously, the best place to go is our RUMC network.
Yeah.
Reach out to your primary care, or you could reach out. Depending on the your medication that you're interested in, your endocrinologist, gastrointestinal doctors, who else? Like for diabetes treatments, we do lupus, MS. There's a whole bunch of array of things.
Yeah. So they basically just get a referral
Get
from
a
their
referral.
doctor?
So they get a referral. They can call up our infusion center, and then we start the process with the paperwork, and we work with their doctors, and then we set the appointment, and then they come in.
Great.
It's a pretty easy process right now.
That's convenient.
As long as we have all the right information, and if the doctor says we need them to come in within like a day or two, we definitely make that work, which is good.
What's your inpatient versus outpatient ratio usually in the center?
Inpatient meaning in the hospital?
Yeah, like people who are already in the hospital coming from.
So I have right now probably that I personally know probably a good like maybe 20 people that are inpatient, and then they go outpatient.
Yeah.
And a lot are outpatient.
Yeah.
They
Okay.
come outpatient, which is good.
Yeah.
But like I said, if something goes wrong and we really need them to be hospitalized, and God forbid something happens in the room, I get them to the emergency room, and then if they have to be admitted, I help with that process.
At least
as
it's
well.
all in one building.
It's all in one
Yes.
building, and I help with that process and make sure that they, are going from the emergency room up into a bed in the hospital,
Nice.
which is like that's the convenience of something happening.
Of course.
Where if you're on somewhere else outside, you have to wait for an ambulance to come,
Yeah.
right?
No, of course.
And then you have to wait to go into the hospital in the emergency room. So this is very controlled environment,
Which helps.
which is nice.
Definitely keeps things safer for sure. So let's discuss, the growing trend of immune globulin therapy, referred to as IG infusions, like you mentioned before. So what is that for? Who's it for? What are the benefits?
So the immunotherapy is basically for people that have autoimmune diseases, and that can be anything like rheumatoid arthritis, celiac disease, MS, lupus. So it's just for autoimmune diseases. So basically, whatever you have a weakened immune system, we're going to infuse that into you to build up your immune system. With MS patients, especially, they can have all these exacerbations maybe of some people can go anywhere from being like having like a blindness to like, not being able to walk correctly. So they do go for these infusions. Yeah.
So when it's an autoimmune condition, I would imagine that these are patients that stick with you for life if the, condition is not disappearing, or is it something that's just used to...
Sometimes the patients, they'll come for a while, and then they have like a break, and then they come back. So we do see them like with the Crohn's as well. The Crohn's patients, they'll come in.
Okay.
So maybe they'll come in like once every 6 months, or it depends on their regimen really. But we're very familiar with people that have these chronic illnesses, so we're able to treat them, work with the doctors, and make sure they're getting what they need when they come in.
Okay.
Yeah.
That's great. And, what new or advanced therapies are you most excited about that are now available in the Infusion Center?
Well, right now we're working like we just did the IVIG treatments. We're basically looking to expand with other doctors, working with other doctors in the community. I'm personally interested. I do like the biologics part of it,
Yeah.
so I think that's very interesting and up and coming. So more to come on that. But we are, I know we are working with the doctors in the community and the hospital.
Okay.
Yeah.
And, when you got into nursing, did you know that this is something that you wanted to focus on, or did you just kind of fall into it? How did you get involved?
I fell into it.
Yeah. Okay.
I definitely fell into it. I'm a geriatric nurse, a community nurse, so home visits.
Yeah.
I've worked at places in the community like the YMCA.
Okay.
So I was the nurse at the Y, outpatient detox program and counseling.
Okay.
So I basically worked with geriatric patients.
Yeah.
And I actually did some pediatric cases as well in the community, fragile pediatric cases. I did do hospice.
Okay.
As a hospice nurse. I did in the community as well, in homes. I didn't quite work in an infusion center, but I kind of fell into this.
Okay.
It's very interesting.
Yeah. I'm sure it's rewarding.
It's rewarding, and I also, my whole thing about nursing is to make people feel better. So I like when they come in and they get their infusions and they feel a little bit better.
Yeah.
And their, even their regimen with their chemotherapy is helping them. It's a great feeling to have that we were able to help that patient.
Oh, for sure.
Yeah.
And what do you like to do in your spare time to decompress and unwind?
Decompress and unwind. Well, I spend time with my boys. I have 3 sons, actually. So my one son's a firefighter, so that's exciting. He's going to 25. Wow. My other son's in Hunter College. He's 22. So he's hoping, he took the fireman test, but he's hoping to be maybe a professor because he's doing an English major. And then my little one, he's going to be a senior, so he's graduating.
Very nice.
And hopefully maybe he'll be a dentist or something.
Oh.
So I hang out with them.
So they keep you busy.
They keep me busy. I hang out with them, and, I like to travel. I like to take my little trips over to New Hope. Nice. Pennsylvania, Jim Thorpe. So I do like to, that's where I decompress. Okay. I walk around in the mountain air.
Nice. Very cool.
Yeah, and walk and things like that.
Yeah.
Take walks.
Okay. Yeah. Excellent. Well, I would like to thank you for joining me and educating everybody about our Infusion Center.
Thank you.
For anybody who would like more information about the Ambulatory Infusion Center at RUMC, they can call 718-818-3266 or visit rumcsi.org. Thank you so much for all you do to keep our community safe and well.
Thank you.
And that about does it for this episode of RUMC Connections. I'm Meredith Gaskins.